Good evening, everyone. Good evening to my friends on Zoom, on Facebook, and on YouTube. I hope everyone is okay. I am awesome. I'm wonderful. I've had a wonderful day. I hope everyone is like me. And welcome to Parenting Corner once again. I'm your host, Sia Zenani, author, life coach, motivational speaker. And I am today with Busi Mpofu, who is joining us for the first time. And we have Darius, our usual guest. We are going to talk about trauma today, but before we do that, I am going to allow them both to greet you guys, and then we are going to get into it. Busi, please greet our friends.
Good evening, everyone. I am really honored to be part of this conversation today, and I hope that we are all geared to learn about trauma today. So I'd like to thank you, Sia and Darius, for the invitation. My name is Busi. I'm a medical student. I'm currently studying in Zambia, and I'm very passionate about mental health. So I hope we'll be learning something today. Thank you.
Thank you, Busi. D? Darius?
You guys are able to hear me?
Yes, we can hear you.
Can you hear me?
Yep.
Okay, I was having challenges with hearing you clearly, getting you clearly. I'm not sure whether it's the volume on my device, but I've tried to increase. But anyway, we'll still move with this direction. Okay, so good evening, viewers. Good evening, colleagues. It's wonderful to be on this platform as usual to interact on different topics. And of course, today, what has brought us here is the topic of trauma. So I welcome you all. As you may have been taught, my name is Darius Waliachama, your psychologist. So looking forward to interact with you on this platform. Thank you.
Thank you so much, Darius. All right, let's get to it then. First things first. Let's define what is trauma. And I've had people talk about PTSD, which is post-traumatic stress disorder. What is it the same thing? Is PTSD the same thing as trauma? If they are not the same thing, how do they differ? Darius, I can see your mouth is moving, but I cannot hear a thing you're saying. You are muted.
Darius,
Oh,
we
sorry,
can't hear
I was
you.
still muted.
Okay, now you are unmuted.
Can you hear me now?
Yes.
Can you hear me?
Yes.
Yes, we can hear you.
Okay. So first things first, trauma comes from, it's originally from the Greek language. Okay. So in the original Greek language, trauma simply means or refers to a wound. All right. A wound or an injury, a wound or an injury. Now, in the context of mental health, in the context of psychology, when we talk about trauma, we are talking about an emotional or mental injury or wound that somebody sustains as a result of an experience they have or as a result of witnessing an event. All right. So it could be that you directly, involved in that something happens that you experience yourself that leaves that injures your emotions or injures you emotionally, injures you mentally. All right, that is said or that can be said as trauma. Now, at the same time, it doesn't always have to be you being the person that is that is experiencing. Sometimes trauma happens as a result of witnessing. So there are times when you may not necessarily be the person that is in the situation, but you've seen somebody in that situation, and that injures you, that wounds you. Human beings have a tendency of feeling for each other. Okay, whether you're a very bad-hearted person or not, there's always that component where when something hateful or something painful happens to another person, it can get to you also. So when one witnesses an emotionally and mentally injurious situation, that can be said as trauma also. Now, PTSD, on the other hand, of course, PTSD we know is, or we may want to know, is an acronym. Okay, P stands for post, and then I beg your pardon, T is traumatic, then S stress, then D disorder. So that's post traumatic stress disorder. So post traumatic stress disorder comes as a result of failure to recover or to heal from an experience one went through, or something they witnessed. Okay, so um, if somebody fails to heal from that traumatic event they either witnessed or experienced, okay, and then it keeps on coming back in form of flashbacks or memories, and it makes them to relieve the event, even if the event happened last week, it happened last month, it happened last year. You keep on having flashbacks, you keep on reliving the event. That is said post-traumatic stress disorder. So it happens after the actual event happened. So trauma itself is um, is time based. All right. So if let's say it happens now, okay, an event that is emotionally injurious or mentally injurious happens now, whereas PTSD is something that now happens to you later on, where you get to relive that moment, where you get to have those flashbacks. So basically, I don't know if that makes sense. Basically, that's PTSD, and that's what trauma is.
Okay. So trauma is kind of like current, and PTSD is the after
Yeah, could
effects
you
of.
just increase your like speak up? I can barely hear
Okay.
you.
I was saying, so you are saying that trauma is more current. It's what you have experienced now, and PTSD is more or less after effects of you having experienced trauma.
Yeah.
That's
So like PTSD. Yeah, you're actually right. Maybe let me just continue on this. So PTSD may. I don't know if you are able to hear me. I hope so.
yeah.
PTSD may last
Mhm.
for months or years,
Okay.
with triggers that bring back memories of the trauma, and this is accompanied by emotional and physical reactions. So that's how
Mm-hmm.
PTSD works. So trauma is more in the present, and the other one is what follows after. It's like where I would say it's PTSD is the effects of trauma. Okay,
Okay.
effects of trauma or effects of unresolved trauma. The trauma was not resolved, you've not recovered, and then you keep on reliving that experience. You keep on re-experiencing it. Okay, it experience you at the time that it happened. Maybe you shouted, you cried, you did what and what, but then ideally you should be able to heal from that. But then months later, years later, you are still feeling as if that experience has just happened. The same way you experienced at the time that you were traumatized. Okay, at the time that event happened, and you were emotionally and mentally injured. At that moment, you broke down, you cried, you did whatever you might have done. But now, in the case of PTSD, it happens the same thing that happened at the time that that traumatic event took place is the same thing you're going to experience or something similar months later, years later.
So it's like your brain did not let go of the trauma, hence you are re-experiencing it, over and over again.
Can you hear me,
Come again?
Darius?
I think there's an issue with your earphones or speaker or something. Can you hear me? Okay, let me, okay, whilst this is preparing himself there, let me move to the next question. So then, what would be the signs of or symptoms of PTSD? How do I know that what I have now is PTSD? Or someone close to me, how would I know that what they are suffering from is PTSD? What would be the telltales there?
Oh, okay.
Okay. Okay.
Are you able to hear me now?
Yes, we
Yes,
can hear you,
but we cannot see you.
but we can't see you now.
I'll be back soon.
Okay.
Okay. It's clear.
Yeah.
Yes.
All right. Okay. So I think now I'm able to relate with you without difficulty.
Oh,
Yeah.
good.
So as of I'm sure your question was about symptoms, right?
Yeah.
Mm-hmm.
Okay. So the symptoms of PTSD, vary, and they may not be limited to what I'm going to talk about. You know, there may be more. Well, I'll talk about some, and probably because look, we are talking about things that are in the context of parenting. Okay, so these events may happen to the parent, to the child. We're talking about parenting, a home setup. So,
Mm-hmm.
uh, symptoms of uh, PTSD come in form of nightmares. Okay, if you are experiencing nightmares, now I'm not saying now. Remember, uh, the way symptoms are, you know, a symptom of PTSD can be a symptom of anxiety, can be a symptom of stress, depression, and so on and so forth. So when I say nightmares, do not think every time you've got a nightmare, then you've got PTSD. No, no, no. We're just trying to show
Okay.
you that you know uh, nightmares are just one of them, and you would actually need the help of professionals to help you ascertain whether it is indeed PTSD that you're going through. So I talked about nightmares. Um,
Mm-hmm.
yeah, so there are certain things that are hidden, okay, that are hidden in our minds, and dreams help us bring those to the surface. Okay, if you
Okay.
read about dreams theory, to inform you about that. Yeah, sometimes human beings, especially men, it's very common, men or males, boys, it's very common to suppress certain emotions, suppress, to hide, to push certain things away. It's very common.
Mm-hmm.
But
Mm-hmm.
then when but when it comes to reality, dreams help us uh, bring those some of those emotions to surface. So nightmares could be one of them. Flashbacks. Okay, you're seated, and either you're having a conversation with your friend, your girlfriend, your parent, or your teacher, whoever it is, and then as you are talking, suddenly you begin to have those mental flashbacks of what happened at that time. Okay,
Mm-hmm.
there are also tendencies of people um, avoiding situations that will bring the back the will bring back the trauma. Okay, the memory of the trauma.
Mm-hmm.
So I'll give you an example. There was a time I got into trouble over with something or over something, and of course it's I was just implicated in that issue. Yeah. So now what happened was, it so happened that the person that was was aggrieved lived
Mm.
in our neighborhood, and uh, I don't know, for some reason I'm one person that I just never liked the whole idea of being thrown in police cells, even though I know after 1 day or 2 days I may be out. I just never liked that idea. And so just the fact that the aggrieved person was in the neighborhood, there's a way. Every time I used the road, or I was going to church and I used the road, because unfortunately, going to our church, it was on that road, that was where the aggrieved person. Okay, in short, the aggrieved person lived nearby, or next to
Mm.
the road that we used to use. Okay, and if I were to choose another road, I would have to use a very long route, long route, and to some extent I have to spend actually on, let's say, transport and so on and so forth. So every time I was going to church, and especially if I was going to that particular church and I had to use that convenient route, it was always bringing those memories fresh. So i I started now avoiding. Okay, I say I'm trying to avoid using that. Every time I'm going to
Mm.
church, I would rather use another route, long one, which I have to spend on. So now that tendency of avoiding, all right, just
Mm.
showed that I had not recovered. All right, I had not recovered
Okay.
from that trauma. I had not recovered from the traumatic experience. So it showed that I still had the PTSD predisposed within me. Okay, so avoidance of situations that will bring back the trauma. Then
Mm-hmm.
we can also talk about things like heightened reactivity. Okay, heightened reactivity to stimuli. Now when we talk about heightened reactivity to stimuli, we're talking about a situation where you become very sensitive. All right,
Mm.
very sensitive. There's some situations that would require you to be sensitive or to respond in a certain way, but you'd just realize that this fellow is overreacting.
Mm.
Okay, very easily irritable, or they can be easily irritated on just something that is considered small or petty. We can also talk about
Mm-hmm.
things like hypervigilance. Now the way hypervigilance works is where you become too careful.
Mm.
Okay, it's important to be vigilant, isn't it? But when somebody is
Yeah.
too vigilant over certain matters, okay,
Okay.
where you're always expecting, say, okay, what if this thing happens? Okay,
Mm.
let me just maybe give this example. So you discover that some people end up being always on guard of impending danger. Now, look,
Mm-hmm.
the way we were created, human beings are designed in such a way that when there is a threat or when there is impending danger, we enter into survival mode. Okay,
Yeah.
your mind or your body prepares itself to fight, or to flee,
Mm-hmm.
or to freeze in some instances. Okay, but then our bodies are not designed, or our mind is not designed to always be in survival mode. Okay,
Yeah.
you and I are not created to always be survivors. No, you are created to be thrivers. You need to thrive, not to survive.
Mm-hmm.
Survival mode is only in situations when you are under threat, or there's something that is potentially dangerous that is around you. But when you're
Yeah.
always in that mode of expecting, okay, what if this happens? And this is common
Something
even
is wrong. Yeah.
more especially in relationships.
Mm-hmm.
Yeah, this is very common in relationships. You find that maybe you came from a relationship that was traumatizing. Okay,
Mm.
you have verbal abused, you have physical abused, you were divorced, you are like so many things. And then
Mm.
the moment you get into another relationship, you always
You're
be
carrying
on
all
guard
that
to look
trauma
out
with
for,
you.
you know
Mm.
Exactly, exactly. So that shows that somebody has not healed from their trauma. They have PTSD, or they've got a predisposition of PTSD. And now, in the
Mm,
context of children, in the context of children, um, a child would grow up may grow up in a home that is abusive. Okay, parents are fighting, they're exchanging bad words, and then when that child tries to relate with the friends, whenever the friend is speaking to them, even when the friend has got a problem with voice intonation, that those people who they are speaking normally, but they have a problem of
it's like
regulating
they're
their voice,
arguing.
and just because, pardon?
Their tone is like they're arguing, even though they are just talking. They're just speaking
Exactly,
normally.
exactly. Exactly. So now, because this child has grown up in a home where shouting or raising a voice is tantamount, or is equal to fighting, or quarrel. Whenever they have a conversation with a friend who's got a challenge with voice intonation, they always be like, they always be
Freaking out.
scared. They
Yeah.
always have hold back. Exactly, exactly. So
Thank you. Thank you.
such is
Mhm,
indicative.
mhm.
Yes, yes.
My next question was going to be that how do I see that my child is experiencing um trauma response or reaction? But yeah, you have answered that very well. So as a caregiver or parent, it's important that we pay attention, and then we will be able to pick these things up even from children. um do you want to wrap that up, or must I come with the next one?
I honestly didn't hear you, Sia. It was it. I'm really having, I think, bad reception here. I anything.
Yeah, you are. All right, let me ask the next one from Busi then, and hopefully you will be recovering from that bad network. Um, so w- w- I don't think that all of us do experience PTSD after trauma, right, Busi? Some people
Yes.
do and some don't. So what is the I don't want to say the foundation. What predisposes people to experiencing PTSD and others don't? What would be happening? What happens with a person who experiences PTSD and other people experience trauma and they are fine and they never suffer from PTSD? What is the issue there?
Okay. Like you said, not everyone experiences PTSD. We may all be exposed to the same threat at the same time together,
Mm-hmm.
but we may go home and others will be fine, and others, will be distressed for the upcoming months. Even the same is like with soldiers who go to war. Um, Usually, like if 100 soldiers are going, 20 of them may come back and experience PTSD, while the rest of the 80, they are fine and they go home and go back normally to their families. So, scientists and doctors are still learning how to understand the ability for human beings to be resilient, but they've been able to identify some factors that increase the risk of someone developing PTSD. So,
Mm-hmm.
one of the most common factors is the duration of the traumatic experience. Did you just have one encounter with that traumatic experience, or has it been happening over and over and over again? So,
Okay.
for example, if it is one encounter, like a car accident, just at one go, someone who has had multiple car accidents will probably be very uncomfortable with even getting into a car, because they've had enough experiences to feel unsafe, on the road or in a
Mm-hmm.
vehicle. The same as like children as well, since this is a parenting corner. Children who are growing up, like from the time they are toddlers, they are watching traumatic experiences, or they themselves are experiencing traumatic experiences, whether it's physical abuse or verbal abuse. And then, they grow up like that for the first 10 years of their life. They are more likely to experience PTSD than maybe, let's say, you go and visit your uncle and then you see, your uncle beating your aunt, and then you go back home and then maybe forget about it. And, so duration is an important factor. Another one is if you have predisposing mental illness, or if in the family someone has struggled with mental illness, because we know that mental illness is genetic. It gets passed down from one generation to the next. So that alone can increase the risk of you developing PTSD, even when others wouldn't. And it doesn't matter the magnitude of the trauma, because we all respond differently to situations. Even if we're talking about a traumatic experience that involves a person, if the person is someone that you know, someone that you trust, that because of that closeness and because of the fact that you never expected that someone would violate you in any way, someone close to you, whether a friend, a father, an uncle, a husband, that can also make the trauma like it has a greater magnitude, and therefore, like, because it's more destructive, you'll develop PTSD. Another thing, social support. If after going through traumatic experience, you are alone, you don't get to talk to anyone about it, and you have any kind of support. It
No
could
support,
be
yeah.
actual medical support, psychological support, or even just family members. If you don't have that environment that should help you as you deal with the after effects, you will develop PTSD, because the days after the traumatic experience are very critical, and they can increase the chances of you developing PTSD or not. Another thing is your general levels of stress and your coping mechanisms. If you're someone who's just not really good at dealing with stressful situations, and you don't know how to cope with the bad things that happen in your life, if you don't have that ability, the moment something bad really happens, you will not be able to handle it properly at that time, and it will stay with you, and it will become PTSD as time goes. And lastly, the type of trauma that you're experiencing, like things like sexual abuse are very serious, natural disasters, wars. We know a lot of people who had to flee Ukraine just earlier this year, and everything was so sudden and it was so scary. Even us who were just watching from far away, we were terrified. And you can imagine the people, some of us, we know them, we have friends and family who are fleeing, and we were worrying about them. That whole experience is huge. It's very traumatic. I'll just give another example. Recently here in Zambia, we had there were some girls or females who had been missing for a couple of months, and just last month they were discovered incidentally. And not much is known about what was going on with them, but like just the fact that for many months they were locked up in a house. They were probably being threatened with their lives.
That's
They didn't know
traumatic.
when they
Yeah.
would, they wouldn't know. They didn't know when they would come out and stuff. So for those girls, like, what they went through is enormous, and definitely they'll struggle with PTSD for a long time, especially if they do not get the right kind of help. So yeah, those are some of the factors.
Okay. Thank you so much. So, given that as you have said, that some people will develop PTSD after having suffered trauma and some won't. is there like a way of preventing, developing PTSD? Is there something that an individual can say? I'm also thinking about this, from a parental point of view. Let's say I realize that I exposed my children to trauma, and I quickly remove them from the situation that is traumatic. Is there anything that I can do to prevent? Is there an effective way for me to prevent the PTSD after realizing that I have been exposed to trauma, or I have exposed my children to trauma? And or is there a way of treating PTSD? Like, let's say it's not preventable. I don't know. You are the expert here. If it's not preventable, is there a way of treating it and successfully dealing with it, and not it for it not to come back to me, after I can say, now I'm fine, I've treated it. So the first question is there an effective way of preventing it? If there's no effective way of preventing it, is it treatable? And once it's treated, is it like a done deal? Like, this is done forever, it's never gonna come back again?
Okay. So the first question, can you prevent PTSD? That's a tricky question, because first of all, you'd have to, if there are the factors that we spoke about, if you can control those, that would be a method of, lessening the chances of someone developing PTSD. So, for example, even what you said, when you know that you've exposed your child to a traumatic, or your child has been exposed to a traumatic experience, and you quickly take them out. By doing that, you are lessening the duration, of
Okay.
the exposure to the trauma. And if there's social support, as soon as possible, social support, from being there as family members, and also taking the child to experts, psychological experts, medical experts, to be helping the child. That lessens the chances of them developing PTSD. There's other things though that are not controllable, like genetics, family history. But we also spoke about, if you have a pre-existing mental illness, it's important, generally, like, the way we take care of ourselves, our health care, in terms of, checking like making sure we don't develop diabetes, develop hypertension, those lifestyle changes that we make. We also need to do the same with our mental health. So if you know that you are struggling mentally with whatever, anxiety, or you're struggling with depression, it helps for you to deal with that, because you know that if you ever get exposed to a traumatic experience, if you don't have mental illness, or if you have developed coping mechanisms to deal with mental illness, your chances of developing PTSD will lessen. So it's a yes or no answer, depending on the things that you're able to control. If you're whatever it is that you're able to control, work on that, and then your chances of developing PTSD would reduce. And then your second question was on treatment.
Yeah.
Yeah, so it's similar, I
Wait,
guess, to prevention as well. Oh, Darius is back.
He
Okay.
is on
So,
Zoom.
okay.
yeah.
So,
I'm sorry.
yes.
I'm having challenges with StreamYard, so I don't know if I can just contribute before she goes to the treatment.
Okay, you can yeah, you can chip in there.
Okay. All right. Yeah. So, yeah, I wanted to say something on the prevention of PTSD. Now, remember that we say PTSD, or we define PTSD as in one's inability to heal or recover
From trauma.
from a traumatic experience. Okay, so actually, in the first place, if you are to prevent PTSD, one must ensure that they deal with their trauma or their traumatic experience.
Okay.
All right. Do not move on. Do not bury uh, um,
an issue before it's sorted. Okay? Because like I said, most of us love to suppress, emotions and just try to, pretend nothing happens, as if you're trying to distract yourself from it, and then you move on.
Yeah.
Okay. But as you move on, you're going to have some triggers, some flashbacks, and so on and so forth that are going to make you relieve that situation. So it's important to, to have continuous contact with and support from important people in your life. Okay. Then it's also important disclosing the trauma to the loved ones. It's one thing I've noticed. I'll give an example, a good example of rape. People love concealing things like rape. Okay, you conceal it. You one day it may make your sex life with your would-be husband or would-be wife to be bad. All right, because you concealed that rape experience, that traumatic experience. So find some safe space. Okay, if you have to prevent PTSD, find somebody you can disclose those issues with. Then it's also important when you've gone through a trauma, do not identify yourself as a victim. Okay, don't say me I'm a victim of trauma. Okay, or don't have that mentality where you feel like you're a victim of trauma. Identify yourself as a survivor. All right, survivor of trauma, not a victim. Okay, have that mindset of a survivor to say, wow, I survived this, I came out of this. Okay, not a victim mentality. Then another important thing, it's important to use your positive emotions and laughter. I'll give you an example. There's a gentleman I know who got implicated in something he did not do. Okay, and so he was thrown in police cells. And when his friends visited him, they were telling him to say, we know the kind of personality you have. Obviously, because this thing is you did not do it, you may even consider committing suicide. It has made you feel ashamed and it has embarrassed you and so on and so forth. But you know what? Take this positively. Think of Mandela, who was on Robben Island for 27 years for doing nothing but just wanting the freedom of his people. Okay, and then when you come out of this police cell, do not be too sensitive to any talk about police cell. Okay, just laugh about it, joke about it. Call yourself Mandela too, from Robben Island. If people make some mockery of you, laugh about it. So it's important to make use of positive emotions and laugh. Don't look at it in the negative. Yes, it was bad.
Don't take life too seriously.
About it.
Don't take life too seriously.
Exactly. So then it's also important to find positive meaning in trauma. Instead of asking why did this have to happen to me, or why me, ask yourself, what do I learn from this? And going forward, how does this make me wiser and a better person? So find some positive meaning from this. Then it's also important to use your experience to help others who might have gone through the same or something similar, to just help them, like talking to them. So as you talk to them, as you share a story, as you talk about it, you're offloading it. You are removing that bad emotion from your bottle, your inner bottle. Okay, you are emptying your soul of that toxic emotion that you had. So as a result of doing this, you realize that the chances of one relieving that trauma are very low.
Yeah. All right. Let's. Okay. I have load shedding in 10 minutes, so I'm trying to
talk about the treatment.
I want us to talk about the treatment, and maybe in wrapping it up, we can address a question of is there a time limit, in PTSD? If I am now at this age and I realize that I have been suffering from PTSD, is it not too late for me to get help? I think after you speak about treatment, let's talk about that, and then we can wrap it up.
Okay. So I think most of the things that Darius has spoken about in terms of what to do after the trauma are some of the most important things. But if it so happens that maybe you didn't have a chance to deal with the trauma when you experienced it or after, and then you developed PTSD, the the most basic and most sought after intervention is therapy.
Mhm.
So it is important to find a therapist that will help you, unravel the trauma that you went through, and then start to deal with it. So a therapist will have different ways of, like, different types of therapy. There's cognitive
Mhm.
therapy, cognitive behavioral therapy, cognitive processing therapy, and prolonged exposure. So these forms of therapy are meant to um, retrain your mindset, your thought patterns, and sort of like rewire the way your brain perceives the threat. You know, like now training you to realize, okay, the threat is no longer there. You don't have to react the way you're reacting. And
Mhm.
not only is it important to work on a person's perception of the threat or their thought patterns towards, but it's also important because we understand that trauma is not just in the mind, it's also in the body. So a therapist will also have to help a victim of trauma um, be in environments that are calming even for the physical body. So you may
Mhm.
engage in things like artwork, yoga, any relaxation work, anything that will also, move your body, but like in a calm manner. So that, because what your brain remembers, your body also remembers. So
Mhm.
those are just like, when you're dealing with PTSD, it is important, like, to go and find help from professionals, like from therapists who are trained to deal with trauma patients.
Mhm.
And it takes a while to establish a good relationship with your therapist. So if it doesn't work the first time, you can always keep trying to find the right therapist, because it's important to have the right connection with your therapist for their treatment to be effective. And then
Yes.
the
Yes.
next thing we're supposed to talk about is whether there's like a time frame of dealing with PTSD. There
Mm.
isn't. Whichever age, however, like if it has been many years, because PTSD can last 30 years, 40 years in some people. So you can always start treatment at any point. Um, and
It's
it'll
never
be
too late.
effective no matter how old you are. Yes. So I'd
Mhm. Mhm.
encourage, like, you're never too old for it, and it's never too late. You can actually, and a lot of people have lived so long with post-traumatic stress disorder that they think it's normal, and they think, I'll
Mhm.
never get over it. But no, it's actually possible to live a better quality of life if you're able to address what happened to you and learn to, perceive the world and perceive your environment differently.
Some people don't even know that they are living with PTSD. They
Yes.
think that this is them. This is me. This is how I am, and
Yeah.
they are not even aware that they are actually they've been responding to the trauma that they suffered all their lives. So
Yes.
awareness is very important. That people awareness is very important, that people get to know that there is something that of this nature, and there is a way of dealing
Mm.
with it. And I guess it also calls for our own awareness in as parents, that we should pay attention to the children. We don't
Mhm.
rule it out as, no, this is how this child is, and in the
Yeah.
meantime the child is suffering from PTSD. So it calls for us as parents to be very much aware, and seek help as soon as we can, to help the children out. Okay, we have 5 minutes left, and I will call on both of you to say your closing remarks, and we can call it a night. I'm not sure what happened to Daria now. Yeah, but you can.
Okay. Yes. So trauma is something that we cannot really avoid. It may happen to us. It always happens to us unexpectedly.
Sorry, before I give you to close, there's 2 questions that just came in. I'm trying to get to the question chat. Okay. Thanks for the Zoom. Allow me to ask 2 questions. Does getting trauma counseling predispose someone to another trauma than if they stayed guarded and hypervigilant?
Please read the question again.
Does getting trauma counseling predispose someone to another trauma than if they just stayed guarded and hypervigilant? So does me getting trauma counseling predispose me to more trauma, or can I just just stay at home and just be guarded and hypervigilant? What would be
Okay, so first and foremost, it's very important.
You have to answer that in 1 minute, ne? Like 1 minute.
Okay. So first and foremost, it's important for one to get treated for their traumatic experience. Very important. Okay, so you remaining on guard or being hyper vigilant actually worsens the situation. I don't know at what point this person who has joined, who has asked the question, joined us, but we talked about hyper vigilance and always being on guard as not something that we are designed to continuously be in. All right.
Yeah.
It's being vigilant or being on guard is a survival mode that we get into when there is a threat or there is an impending danger. So you're not supposed to continuously be on a survival mode, because that in turn will make you will predispose you to anxiety, and then it will also make you to be a paranoid person, because even when somebody has not done something, or even when something is not exactly how you think it is, you think you in your mind you think, okay, this is it, okay, because it resembles
what you have experienced. Yeah.
Yes. So being on guard or being hyper vigilant is not a solution. It's actually the worst. Therapy always wins as long as you get the right therapist or the right therapy. Thank you.
Okay, thank you. There is another question for the same person, but I'm going to propose that we have a part 2 of this. So we'll answer that question next week. I just want to read this comment and then we say goodbye. PTSD, I can relate. Sharing my trauma's experience with another woman brings me so much joy and relief. I will definitely look into PTSD. Thank you for this session. You're welcome, Tembi, for that, and thank you for that comment. Okay, Busi, let's wrap it up.
Yes. So I just wanted to say that PTSD affects us in all aspects of our lives. It affects your relationships. It affects your ability to work properly, your ability to sleep at night, your ability to be a good parent. So it is very important that we address it if it is there. I'd like to encourage people to not be afraid to deal with whatever trauma that they've experienced before, because the benefits of dealing with it are like across all parts of your life. So anyways, we'll talk more about it next week, but I hope that we can be encouraged to learn to deal with it. Thank you.
Yeah. All right. Thank you so much, Busi, for joining us. Thank you, Darius. It's been a wonderful evening. And from me to all of you, our viewers on all platforms, thank you so much for joining us. Thank you for the comments and questions. We will have a part 2. We will delve more into trauma and PTSD. Thank you so much. Have a good night.
Okay. Thank you. Good night.